Hello, doctor. Could you please share us some information about coronavirus? What is coronavirus?
See, coronavirus is like a family of viruses which can cause simple things like a common cold to more devastating infections like SARS in the past. So it's a family of viruses.
Okay. Is it only in China?
No, it started off in China, in the Wuhan city. Basically, it's supposed to be zoonotic. The virus would have started in an animal. It's been claimed could be a bat, and then it would have had some kind of an intermediary host, and then it has infected the human. So it has started off in the epicenter is the China, Wuhan city, but now because of the modern day we traveling and coming across travelers from all over the world, it is now almost present in most of the world where you have patients infected from this. Unfortunately, even India has got few patients which are infected from coronavirus.
Okay. Can you please tell us, how will we get infected?
It's like any other catching a common cold. So if a person coughs or sneezes, or if you touch him, so it can spread. It's an airborne disease, but it can also spread by touch.
Okay. How long before I show symptoms once infected?
See, this is called as incubation period. From the time you get exposed to the virus, it can take as much as 12 to 14 days before you show symptoms. So if you have been exposed to a person who has visited China recently, then the chances of you getting this is in the first 2 weeks. And if you're not infected in this or you don't show any symptoms in these 2 weeks, then it's unlikely that you will be infected with this virus.
What are the symptoms, doctor?
The symptoms would be like cold. You will have high temperature, you will have sweats, cough, sneeze, and runny nose.
Okay. Any cure for the corona infection?
The WHO is working hard on this, but I think the cure is at least 18 months away. There is no vaccination as such for this virus.
Okay. Which people do you think are more susceptible and how many die from this infection?
So in terms of susceptibility, in the world there are almost 50,000 cases so far, and the death rate is about 1,200. So the mortality rate, what we call the death rate, is less than what SARS was before. So the people who are susceptible for these are the common elderly gentlemen, people who are immunocompromised, like who have got uncontrolled sugars, who are on other treatment. So what we call as the fragile or the elderly population, or even the younger children may be more susceptible than a healthy individual.
Okay. How can we prevent the spread of infection, doctor?
Simple things like closing your mouth when you sneeze or cough, or ideally to use your elbow to cover your face would be a very simple and effective way of preventing and spreading of this disease. And wash your hands regularly, and personal hygiene. And if you're cooking food, make sure you eat a well cooked food.
Thank you so much, doctor. I'm sure this will definitely help the people out there. Thanks. Have a nice day.